Welcome back to the program. Angelina Jolie's decision to have a preventive double mastectomy came after doctors estimated she had an 87% risk of breast cancer because of her genes.
Well, the Hollywood actress inherited a faulty gene known as BRCA1 that raised her chances of breast and ovarian cancer. Now, the first clues came from her family history. Her mother battled breast cancer and died of ovarian cancer. Her maternal grandmother had ovarian cancer.
But even though the majority of women out there don't have this faulty gene, it's still best to be informed of what needs to be considered. So this morning, to tell us more about faulty genes and who is at risk is Dr. Khoo Kay-seong, Deputy Medical Director and Senior Consultant with Parkway Cancer Center, and Dr. Tanya Yuan, General Surgeon with the Pan-Asia Surgery Group.
Good morning. Thanks for joining us.
Morning.
Let's first talk about Angelina Jolie's case, because we've got to have a better understanding. I mean, this faulty gene that she has is BRCA1, is that correct?
That's right.
Tell us a bit more about it.
What is a gene that can be inherited? BRCA1 and 2, if there's a mutation or an alteration in the gene, confers a higher risk of the person getting breast cancer. So in the case of Angelina Jolie, the mutation on the BRCA1 gene increases the risk, a lifetime risk of getting breast cancer to as high as nearly 90%. So same case for BRCA2. They are also at the higher risk of getting ovarian cancer.
Right.
So a presence of a mutated or altered BRCA1 or BRCA2 increases the risk of a woman of getting ovarian and breast cancers.
It increases the risk, but in reality, how many of the women who have this faulty gene actually, sees, a mutation of the gene or cancer cells?
So the mutation in BRCA1 or 2 in all breast cancer patients is probably about 5%. In some populations, about 10 to 15%. So not all breast cancer patients will carry that faulty gene. But if you talk about in the general population, then the incidence of an altered BRCA1 or 2 is less than 1%.
Okay. So the actions she's taken is fairly drastic, but I think most people would consider surgery. Is that the best option to sort of cut it out and say, well, I guess if it's not there, then I'm that much safer?
Well, it depends on the patient. For BRCA mutation carriers, if you do a preventive bilateral mastectomy, you do reduce your risk by more than 90%. But it's not 100%. So you could still get breast cancer even after the bilateral mastectomy. So the alternative is to do intensive surveillance. And for high-risk women, what we routinely offer is 6 monthly surveillance. So, for example, they would do MRI, 6 months later mammogram and ultrasound, and then 6 months later MRI again. So we keep doing, so every 6 months they will have some kind of test to examine the breast, and this should pick up any early cancer changes.
That is if you have the faulty gene in you, right?
Yes, or women who choose not to do the gene test but do have a very strong family history.
Okay. But we also mentioned that it's not a common gene, it's sort of a rare faulty gene, so only about 1% of the population actually has the gene in them. Does it mean that, the first question women will ask is, should I go for the test and see if I have the faulty gene in me? What would you say?
Well, that's a good question. I mean, it's certainly not a test that every woman on the street should go for. I think you should start with an assessment of what is the likelihood that a person will carry such an altered gene. Like in the case of Angelina Jolie, she has a very strong family history. Her mom had breast and ovarian cancer. Her grandmother had ovarian cancer. So in such a scenario where there are multiple generations with either breast or ovarian cancer, or if there's an individual in the family with both breast and ovary cancer, or bilateral breast cancer in both breasts, and that increases the risk that such a faulty gene may be present, and then we can start testing this woman. If this is in a family with no breast cancer at all, or a single breast cancer at the age of 80 years old, then the likelihood of finding an altered gene is very small. So that will not be the situation we want to test.
So those are the questions you should ask yourself first and relook at your family history before you even consider it. But if I were to consider it, I mean, at what age should I be going for these tests?
I think once the woman has completed her family and she wants to think about whether she wants to do all this preventive surgery, then that might be time.
Because of the ovaries,
I mean, so assuming that if you have a family history that, sort of checks all those boxes and then you want to go for tests, what kind of tests are available? Where should people begin?
And it's a blood test. Testing for mutation is just drawing a blood and we send it to an accredited laboratory. They'll screen the entire BRCA1 and BRCA2 gene, assuming that none of the mutations have ever been documented in this family. Then you screen for both BRCA1 and 2 and look for mutations. So it is a blood test. But before a test is done, I think it's highly recommended that the person speak to a surgeon, an oncologist, and get proper genetic counseling. Because it's not just testing the gene, it's not just paying the money, but it's also to understand the implications of doing such a test. What happens if it turns out positive and what happens if it's negative? What does it mean to you, to your family members, and to your next generations?
When you get the test results, will it, for example, say if it tests positive, can you then say it's a 10% chance or it's a 50% chance or 80%? Are you almost able to give those numbers to a patient? Because again, unfortunately, once you say you have cancer, whether it's a 1% chance or a 50%, I think people start worrying regardless.
Of course. I mean, for BRCA1, the estimated risk, a lifetime risk of getting breast cancer is between 60 to 80%. In the case of Angelina, it was about 87% by their estimate. For BRCA2, it's somewhat lower, but it's still significant risk.
Is that usually, once you are assessed to have a high level of risk of getting both breast cancer, ovarian cancer, is that the first thing the doctor will advise to do? Perhaps you want to consider preventive mastectomy, or are there other options that women should be looking at?
Well, I think once the woman has been diagnosed with a BRCA gene mutation, we do always talk to them about such an option of preventive mastectomy, preventive surgery for the ovarian cancers. But at the end of the day, it is still up to the patient to decide whether she wants to take that big step. Intensive surveillance is a very good option, and many patients do, in the end, would rather do surveillance. And then if they were to get diagnosed with a small cancer on one side, then they take the big step to do a preventive mastectomy for both breasts.
How much difference is it to catch it early, as in before it's even occurred, versus once it's occurred, even just a little bit? I mean, that's what people will be weighing, you see. Should I do it first before it's even happened? Because we always say prevention is better than cure, right?
And we're scared that it will spread fast, or there's no turning back.
Well, I think if the patient is undergoing intensive surveillance, we can catch cancers very, very early, in the stage 0 or early stage 1 phases. And the cure rate for early stage cancer is very, very high. Of course, we also have to take into account it's just the emotional trauma of being diagnosed with cancer, and that is what a lot of women want to avoid by doing the preventive surgery.
What about men, Dr. Koo? I mean, this also can apply to men. Is it the same situation, the same scenario?
Yes, if a man were to carry a 40 BRCA1 or 2, the risk of breast cancer does increase, especially if they carry an altered BRCA2. It's only 6%. It's not as high as what woman would be. But on top of that, mutated BRCA2 also increases the risk of the person getting prostate cancer, so as high as 20%. So that is the additional implication for men who carries the 40 BRCA2.
And for men as well, at what age should they, if they want to get tested, at what age should they go for it? After they hit their 20s, or?
Because the overall risk of getting breast cancer is so much lower, it's only about 6%, it's less than 10%. And I think less people are doing so, but they can be tested anytime when they can understand the implication of such a test. So that means anytime from 21 years old onwards. Then they can choose what they want to do about that piece of information.
Okay. All right, well, thank you so much for coming in and sharing with us this morning. Of course, like with all things, the most important thing is to speak with your doctor, to consult them, and to get clear information about your situation, because it's different for everyone.
Indeed so. Dr. Koo Kay-seong and Dr. Tanya Yuan sharing their insights on preventive procedures concerning breast cancer.
We're going to take off for a short break, but coming up next...
I watched you murder innocent men and women. I will make you answer for what you did.